Okay, good afternoon. I am a nurse, and today I am going to assess a patient who arrived at the hospital in pain. First, I ask the patient where the pain is located. The patient tells me that it is in the lower back and mainly of the right side. I ask what kind of passion they feel, and they said it is sharp and stabbing, and sometimes it feels like burning. I asked the patient to describe the pain in more detail, and they explain that at first it was only in the back, but now it is spreads to the hip and sometimes to the right leg. Next, I ask about the pain intensity on a scale from 0 to 10, with 0 being no pain and 10 the worst pain imaginable. The patient raised the pain as an 8. I also ask when the pain started, and they tell me it began yesterday afternoon when I lived in a heavy box and hasn't gone away since then. I asked if the pain has changed over time. The patient explained that the intensity varies, but the pain is always present and sometimes change location. I ask if the patient have experienced any secondary effects of pain, and they tell me they tell me they feel fatigue, dizziness, and nausea, and the pain has affected in their sleep. I also ask if the pain limits daily activities, and the patient says it is difficult to sit upright for more than a few minutes, and walking worsens the pain. To continue the assessment, I explained that I will check their vital signs using a stethoscope, and if the pain persists, we may use a IV intravenous line to give medication. I also asked if the patient have taken any medication before arriving. They mentioned taking has a painkiller at home, but it did not relieve the pain. I assured the patient that we will monitor their symptoms and provide the appropriate treatment to relieve their pain. And with all this information, I can ensure that the patient receives safe and effective care, and is all for my final exam. I don't know.